What's up, you guys? My name's Miguel, fellow Xray Tech Peep here, giving you the X-ray knowledge you need. And today we are covering X-rays during trauma. So, depending on the level of trauma that your facility is, the protocol may be different. I'm at a level 3 trauma, so I'm just giving you a general idea, mainly for the students who are out there or for anyone who's new to the field. Keep in mind, every department is different, protocols and all that. So in ours, if we have a trauma coming in, there's different types of traumas. There's just a trauma where it'll be someone does like some minor thing and it'll be considered still trauma. Either like they'll fall, and then there's actual more true traumas where it's like higher level, like trauma 1, where they had to fly them out to like trauma 1 facilities and stuff like that. So depending on the trauma will vary the situation you're in. But for the most part, in our department, we are in the ER. There'll be a little pager that rings off, and it'll be like telling us there's a trauma coming in, how many minutes. So we usually call to the hook, which is someone in the ER department, the one that foresees everything, and they will tell us trauma's coming in, so many minutes out. This is what what the reason of the trauma was. So depending on what they tell you, like if there's a motor vehicle accident or like gunshot wound, depending on what, you can kind of in your mind already know what to expect. Like for a motor vehicle accident, and depending, you're like, okay, maybe there'll be some shoulders, some extremities, some chest. Kind of have an idea of what's what to expect. So usually going in there, they, depending how severe they are, they might just need you stat up there. So you just pull up your little machine. Depending on how bad the patient is, you can either go in there and you'll have to, on your portable usually, hit trauma on your little thing, and then later on they'll put the order of the patient and everything like that. Or usually someone in the department's already working to get the order put in, but you'll shoot it under trauma and then later on put it under the right information. That's one situation. Or if it's not a severe trauma, usually they'll put in the order and then you'll pull it up and you'll be able to do it the more proper way. So depending on how severe the patient is, you would usually take another tech with you if they're really bad, so to help you with positioning. Worst case, there, if it's a true trauma, everyone's in there. There's a doctor, there's nurses, there's respiratory, there's everyone's in there if it's true trauma. So if you go in there and they really need your chest X-ray and they see you struggling, they'll jump in and help you. Or worst case, you just ask someone. And I mean, they don't, of course, they don't know anything about X-ray, so you just want them to be your, like, just lift them up, help me move this, basically be like your assistant. And then you'll shoot it. Usually the doctor, the doctor, or the physician, or whoever's in there, will look at the X-ray and they're like, okay, we need to do this and that. Let me adjust it, and then they may need you to shoot it again, or just carry on your way. For certain extremities, depending how broken they are, you might have to do cross tables or just one view sometimes of just shoulders, or depending how bad. It's kind of depending on the severity. For extremities and other stuff, if there's a lot of blood, you might have to put little covers on your cassette, just to keep you safe, and make sure before you expose if everyone's in there to say X-ray. Give enough time for everyone who wants to step away, to get out of the way. Sometimes they'll say there's traumas in, and you'll call, and it won't be like a trauma that require actual X-rays. So, kind of give or take. During the day, from where I'm at, you may get like a few traumas that will come in. In the nighttime, I've seen a little bit more. It's more of the ugly ones that come in, especially on the weekends, holidays. Some people with DWI, alcohol and stuff like that. So that's pretty much about it. I mean, I would say how stressed you are as a tech. Well, it depends on you, cause some people are very they get squeamish when there's blood or you see bones sticking out. Kind of got to make sure when you go in there you have a mindset like, okay, I'm expecting this that, and to know that, okay, my X-ray is not going to be perfect, and like sometimes you feel pressure from like the doctors because you'll shoot it and like maybe something's not positioned correctly, maybe it's clipped, maybe there's something so you got to reshoot it, so they kind of put pressure on you. You feel stuff like that, or like maybe you'll have a malfunction on your portable, it won't load, or it'll clip something that'll get you a little bit more nervous. But I mean, if you go in there, do your job, shoot it, and it comes out good, the doctor will look at it and be like, okay, good, you can leave, or we'll need you to stick around if we need to intubate them or we need to do other stuff. That's, I mean, about it. I mean, just got to be careful because there's windows. Some departments have windows of where you have to call in and be there, so they'll time you on that, and they'll keep up. It's more for like patient care to make sure that the department's doing their job and being there on time. And yeah, that's pretty much it in a nutshell. Once again, everything depends on your level of trauma and your protocol. And yeah, see you in the next one.